Pelvic Inflammatory Disease or PID. Pelvic inflammatory disease is the inflammation of female pelvis structures characterized by spread of infection from the cervix through the uterus to the fallopian tube, ovaries, and adjacent peritoneum. It is a upper genital tract infection and not infection in the vagina or the vulva. Clinical types of pelvic inflammatory disease. We have acute and the chronic type. In the acute type, the patient has generalized symptoms, lasts for few days, may recur in episodes, very infectious in this stage. Epidemiology of pelvic inflammatory disease. It affects up to 1:4 in women. It is seen in many hospital admissions, sometimes fatal. There is chronic damage which causes infertility. It predisposes to ectopic pregnancy. It can affect the baby during birth, resulting in lung inflammation and eye infections. It is the common cause of chronic menstrual problems. Etiology of pelvic inflammatory disease. Specific sexually transmitted organisms in 85 to 95% cases. This include Neisseria gonorrhea, Chlamydia trachomatis, and Mycoplasma species. Due to reproductive tract damage seen in 5 to 15% cases from pregnancy, from surgical procedures, or due to insertion of intrauterine devices. From commensal organisms like E. coli and Streptococcus species, tuberculosis. Pathogenesis of pelvic inflammatory disease. Infections can occur frequently after procedures that break the cervical mucous barrier. The endometrium sheds regularly, so is infrequently a site of chronic infection. Risk factors of pelvic inflammatory disease. Age of the first intercourse, number of sexual partners, cultural practices, for example, polygamy, prostitutes, attitude of menstruation and pregnancy, frequency of intercourse, poor health resources, and antibiotic exposures. Diagnosis of pelvic inflammatory disease. If the patient has lower abdominal pain in 90% of the cases, fever, mucopurulent discharge from the cervix, and pelvic tenderness. Tests for pelvic inflammatory disease, whether is raised WBC count, laparoscopy, ultrasound evidence, and endocervical swab for organisms. Treatment includes antibiotics, which needs appropriate spectrum of activity, specific or broad spectrum. Strict compliance is essential, oral or parenteral to be selected depending on the severity. Surgical management includes drain abscess, selective or radical removal. Rest and analgesics, anti-inflammatory drugs are useful. Prevention measures include screening and treating the asymptomatic disease, sexual health counseling, barrier contraceptives, progestin-based contraception, sexual abstinence, improving education and the status of women.